Hello and welcome to the Wyoming Breast and Cervical Cancer Early Detection Program and the Colorectal Cancer Screening Program question and answer session for January. We're going to go through, have a few of our staff will be speaking about different aspects of the program, and we'll be welcoming questions from you if you have any at all, or you can save them to the end. You can feel free to use the chat box. You can unmute and talk at any point that you have questions on different aspects of the program and how it's run, or save them all for the very end. Just to let you know, this will be recorded for other providers who can't join us today, so we'll put it on the website at some point in the near future. So just to let you be aware of that as well. And if there's no questions to start, we will begin. So just some general updates to begin. And first of all, to say thank you for sending in your applications for the quality improvement projects. The RFA, it was great to see so many providers submit requests to be part of this opportunity, and we are still working on getting contacting all of the applicants in due course, and it's very great to see that. And just also another update that we're going to try and hold these sessions monthly. They are live Q&A, so any questions that you have about the program that you want to ask all of the staff who run different parts of the program, that everybody is here ready to answer those questions and to try and help move your participation forward with us. So we want to try and keep these on a regular schedule as well. So if we would like to start with Nicole Motter, who is our enrollment and data specialist, and she's going to talk to you about enrollments.
Okay, reminders of the 7 to 10 business days it takes the WCP to process an application, as multiple systems have to be checked before someone can be enrolled. All fields are required, and in gaps means we have to call the client to gather the data, which severely delays the time it takes to process an application. So please make sure that all those applications are getting filled out completely, so we don't have to make a lot of phone calls, and hopefully we can get that and get those processed as quick as possible. All appropriate clients will receive their ID number via mail, email, and be notified of general acceptance via phone and voicemail. All applications that are processed, we are calling the client and letting them know when we send out the packets that they have been approved for the program. We will leave messages for those clients that we don't get a hold of, and then they also have the option of being notified by email and as well. So any questions on that?
All right, well, thank you, Nicole, for that section. So for our next installment, we will go to billing. Our billing manager is not here today, so I'll be stepping in for Megan with this next section. So claims that are electronically entered and attachments can be added to via the CNSI platform. So if there's an issue and it does not allow for immediate attachment, the claim will be suspended for up to 30 days, but you have within that 30 days to get back into that claim to attach what you need to attach, and then it will be processed accordingly. So if there's any issue with that day, that time of filing, that you can't put an attachment on, it will suspend unless you put something on, but you do have, within that window, do get into the system, put that attachment in, and you will save some time and some issues with that obviously going into denial if it goes beyond the 30 days. Again, once that attachment is loaded, it will process. And if there's any questions or concerns, please let us know as soon as possible, and we will help you if there's any issues with attachments or anything regarding billing at all. Megan Westwell, our billing and data manager, will help you with any questions that you have. If there's no questions right now, again, feel free to unmute and to put questions in the chat, but if there's none right now, we're going to move on to our next installment, which is for our program nurses. So I'm going to hand you over to Tanya Rikins.
Good morning. My name is Tanya Rikins, and I'm one of the program nurses here at the Wyoming Cancer Program. And one of the benefits that our clients have is if they're diagnosed with any type of cancer, whether it be pre-cervical, cervical, or breast cancer, they are eligible to be transitioned over to Medicaid through the program. So our main goal is to make sure that we prevent any gaps within coverage. So we want to be notified as soon as possible, so that way we can start the referral process. It is up to the client to complete that referral process by submitting application through Medicaid, as well as submitting their income tax, proof of citizenship, and Medicaid will go over the application with them either by phone, or they can file the application through a written application. But it's really important that the program be notified right away when an abnormal test result is obtained by the provider, so that way we can start that transition fairly quickly. Our goal is to make sure that it's under 60-day notification. We also will make a referral over to Live Health, which will actually help them find other sources of support that the patient may need in that cancer diagnosis. Thank you. Any questions? Perfect.
All right, so we'll move forward to our next section. Let's click on here. Okay, so don't forget you can sign up to receive newsletters by visiting the WCP website, and you can click on the link there. There's also, this will be available as a PDF format, clickable PDF, so you can click on these links and you can sign up for the program newsletter and also the Cancer Coalition newsletter as well. So we recommend that you do that if you haven't done so already, or if you have new staff at your provider centers, that they can get onto these newsletters and keep up to date with what's going on in the cancer world. So we will be sending out a link for the next session. So it will be held in February. That will be coming out via that newsletter soon. For those obviously starting to learn about the links to those newsletters, or at least one person in the organization who has that newsletter signed up will get the link for the next session. So we do recommend that you try and come on if you have any questions, and you can hear what everybody else is going through and to learn from each other. And if you do have questions, please bring them to these sessions. We do welcome it. It's a chance to have all of the staff here to answer your questions, so we can get you the help that you need. And that's it from us. So we're going to give you some time to format some questions. So we're going to give you a few minutes if you have any. If not, we'll be closing down this session in a few minutes if there are no questions. But we do thank you for participating and for joining us. And hopefully you've got some good information about things that we're working on in the meantime. So again, feel free to unmute the microphone. You should see the mute button in the bottom left-hand corner if you're on the computer. And also you can use the chat feature if you want to type out those questions instead. And whilst you're thinking about any potential questions, we do have our main cancer program phone number and email address there. Any questions, concerns, you can call and get directed to the member of staff that you have most urgent need to talk to. Emails as well, you can make for the attention of said person, and we'll forward it to them so they can help you directly. So easiest way is to contact the program, and we'll get you to the right person for support for billing. Obviously, Megan Westfall, she's not here today. Anything with enrollments and data, Nicole Mutter. Anything you need to reach me, Mark Kelly, and our unit manager, Star Jones, if you need anything else as well. And our nurses, Val and Tanya, for any medical related program information. So we'll just give this another minute or so, and then we'll close it down.